This is my student support system. Keep watching, keep learning. Hello, welcome to my student support system. In today's class, we will discuss a sexually transmitted disease, gonorrhea. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture. Or you can directly visit to channel My Student Support System. What is gonorrhea? Gonorrhea or gonococcal infection is a sexually transmitted disease and it is bacterial which affects mainly columnar and transitional epithelium and differ in males and females in course, severity and clinical manifestations. What is the causative agent of gonorrhea? Gonorrhea is caused by a bacteria that is Neisseria gonorrhoeae. It is a gram-negative diplococci bacteria which was isolated by Albert Neisser in 1879. How it transfers or the mode of transmission? It is transmitted by contact with the exudates or discharge from the mucous membrane of infected person and almost always as a result of sexual activity. That's why we call it sexually transmitted disease. Gonorrhea can also be spread perinatally, means from mother to the child during childbirth. If the mother is suffering from gonorrhea at the time of delivery, and in children over 1 year of age, it is considered as an indicator of sexual abuse. What are the clinical manifestations? Mostly the infection is asymptomatic or very less symptoms are there initially. Asymptomatic infection are common in both males and females. In men, infection is characterized by urethritis, means inflammation of urethra or infection of urethra, which leads to burning micturations, means pain during slight burning pain during voiding or urination. Mucopurulent or purulent discharge from the urethra. Patients with Neisseria gonorrhoeae infection may also result or report painful swollen testicles. And in females, signs and symptoms are often very mild and mostly overlooked. But when they appear, they include purulent discharge from the urethra, cervix or vagina. Infection of the Bartholin gland can lead to secondary infection, abscess formation and cyst formation. How we will diagnose it? The laboratory diagnosis of Neisseria gonorrhoeae infection in women is made by testing endocervical, vaginal or urine specimens, and male urethral discharge specimen may also be tested for gram stain in symptomatic cases in men. Now we come to treatment. Recommended treatment for gonorrhea is use of antibiotics as it is a bacterial infection, and most commonly used antibiotics are doxycycline or azithromycin along with ceftriaxone, ceftriaxone or ciprofloxacin. So two drug regime is there. These antibiotics are not recommended during pregnancy. So alternate method or in treatment should be started. So the client, if suffers from the disease or having the sign and symptoms, should contact to gynecologist. The emphasis should be given on prevention. Emphasis is placed on early detection and effective treatment of the patients and contacts to prevent spread of infection. Health education to the community in general, health promotion measures, sex instructions or sex education that teaches the value of delaying the sexual activity until the onset of sexual maturity. Then protect the community by preventing and controlling the STDs or sexually transmitted diseases in sex workers and their clients, and by discouraging multiple sexual partners and casual sexual activity. Teach the methods of personal prophylaxis applicable before, during, and after exposure, especially correct and consistent use of condoms. Provide a healthcare facility for early diagnosis and treatment of sexually transmitted infection and encourage their use through education of the general public about symptoms of STIs and mode of spread or transmission. Make these services culturally appropriate and readily available and accessible or acceptable to the people regardless of economic status. Establish active case finding programs that include interviewing the patients and partner notification, and the use of prophylactic agent in the eyes of newborn it is an effective prevention method of neonatal gonococcal infection in the eyes. Thank you students for watching this video. You can subscribe the channel for latest updates of such valuable videos, and for making your notes don't forget to visit mynursingstudents.blogspot.com. You can also follow me on Twitter, Instagram, and can join Facebook group Nursing Notes. Thank you. Have a nice day.